Iron and vitamin B12, both essential for making healthy red blood cells. But a deficiency in either one can lead to anemia, with very different causes and symptoms. Let's break it down. Iron deficiency anemia happens when your body lacks enough iron to make hemoglobin, the protein that carries oxygen in your blood. It's usually caused by blood loss, poor diet, or pregnancy. B12 deficiency anemia, on the other hand, happens when you don't get enough vitamin B12 or your body can't absorb it properly. That's often due to a condition called pernicious anemia, certain medications, or digestive issues. Here's how they compare. Iron deficiency, fatigue, pale skin, brittle nails, shortness of breath. B12 deficiency, fatigue, plus nerve issues like numbness, tingling, or memory problems. Treatment also differs. Iron deficiency is treated with iron supplements or dietary changes. B12 deficiency may require B12 injections, high-dose tablets, or treating the absorption problem. Blood tests can tell the difference. So, don't guess based on symptoms alone. In short, both cause anemia, but the underlying issue and treatment are completely different. If you found this helpful, hit subscribe for more medical animations.